Hi, I'm Dr. Pannozzo. Thanks for watching our program. The patients you're going to see are regular patients from my practice. Whatever they say on camera is how they feel and what they want you to know. So enjoy the program, and if you have any questions, write in and we'll answer them. Thank you.
Dallas Perry. I was a law enforcement officer for 25 years. I've raced dirt bikes over the entire state of Florida for probably my entire life. I run. I'm an athlete. I've been to the chiropractor. I have a file that's probably that thick from going to the chiropractor 3-4 times a week, and it cost me a lot of money. I heard Dr. Pannozzo on the radio, and I thought about it, and after probably 6 months, I came down here. When I got here, I told him about my lower back hurting, and I couldn't touch my toes. He did the x-ray himself. Took 5 minutes to have an x-ray done. When you go to the doctor and you wait for 45 minutes, it's not because it's taking that long for the x-ray, it's because they're that slow. He immediately told me that my right leg was 1/4 of an inch shorter than my left leg. He gave me a wedge to put in my shoe, and he says, that's going to fix you, but if you want to walk out of here pain-free today, you should I need to give you a couple of shots. I won't lie to you. Those shots were in my lower back, and they were a little painful. But when I got up off the table, I touched my toes for the first time in a long time.
How long? Like, is it years or?
I couldn't even give you, I couldn't remember the last time I touched my toes.
Wow.
And I got up and I reached down and I touched my toes and I stood up and I was pain-free. Like I said, I'm an athlete and I'm always moving. About 6 months later, my back started hurting again, and I came in and the same thing again. He gave me a couple shots, and now it's been almost 2 years. I was doing deadlifts last Tuesday, and I'd never really done them before, and I tweaked my back a little bit, so I stopped, and I thought maybe it was just a muscle strain, and I waited about a week, and it's not getting any better, so I'm here today, and I fully expect to walk out of here today pain-free. One more shot, and that one he hit the scar tissue, lit me up for about 5 seconds, and when I got up, I touched my toes, and I'm a firm believer.
So when he found the right spot.
When he got the scar tissue, and he knew it, I mean, I didn't know what he was doing. He said, it's not moving enough yet. And he went back in, and that next one hit the scar tissue, and I made a noise. And I'm pretty pain tolerant.
So when he finds the right spot,
absolutely.
The shot's a little bit more.
I'm a firm believer. It's not my second trip here either. I was working out last week, and I tweaked my lower back again, and I thought it might just be a muscle strain, so I let it go for about a week, and it's not getting any better.
All right, where is it? Left or right?
Probably, I would say, left side.
And where about? Low?
Low.
Does it go in your leg or anything?
I haven't felt any tingling or anything, so.
It'll pain across here, back there.
Mostly just right in the muscles in my lower back.
All right, stand right here.
If I do try to pick my leg up, it starts to hurt.
Ooh. Turn right around. Hey. Go ahead and bend forward now. See if we can capture this pain. Go ahead. Where is it?
Right.
Right there. And backwards. That's good. Go left, then left, and then right. That's going to be a joint between the third and fourth bone. All right. You did good.
I did good.
Whatever you did.
I want to get back to working out. I don't have time to lay around.
Hey, you need the shots, right? All right. Come on back.
Common mistake in the gym.
I went light just so I could learn to do it. But I had kind of gotten away from working out when I retired from the sheriff's office, and it just
Yeah.
muscles got weak.
Like when you retire, who's taking all those? Who's taking all the perps?
Yeah, they got another guy to do it. There's always another deputy to come up.
Always another guy.
Is he as good as you were, though?
It depends on who you talk to.
Ooh.
Most of the people I talk to say that he's not as easy to work with as I was, but he's doing a good job.
The ones that perps get off the street.
And there's always a workforce for in the jail.
All right. More right here, right?
A little bit higher. A little bit higher than that. Maybe lower.
It's a 2-3 level. Right here.
Yeah.
Third one in a row. 1, 2, 3. Third one in a row.
It's usually L45. That had to be the right spot.
Always seems like it's backwards. Where the pain is not where the shot hurts the worst.
Yeah, you're always dealing with the primary and secondary. Alrighty. You want to take a picture of this?
You should.
Everything
Camera.
is straight. Now we worked on all these.
Yes.
Except this one. See, it's locked over on the
Oh,
left.
yes.
And, so that's why you got the 3 shots. Now, once you get these shots, they're fixed.
I agree. Thank you.
All right.
Yeah, that hurt. But I'll be better. I will be better.
Yep.
I couldn't have did that when I walked in here. Not without having to have a little help getting back up. So,
So you couldn't have picked up your sunglasses?
I could have picked them up, but I'd have had to have some help getting
You would have
down. You know, I
pain,
mean, I couldn't have did that when I walked in. So, yeah, this is
Let's see how you pick up the keys.
you know, I could not have done that. I've been for days doing this. Pick my cat up to feed her in the morning. I go one of these numbers, pick her
Wow.
up, put her on the counter, and now I could, you know, I'm ready to go back to work out. I'll be in the gym tomorrow.
Doing deadlifts of 160.
No, I'll be doing 85s. I'm smart.
I'm just kidding.
I'm trying to get my strength up. Then I'll
Yeah.
start doing 165s and 225s and.
They don't have.
Well, thank you, Doc. I was able to manage to do my work at work. Friday, my shoulder starts bothering me again, so I took Advil. Aleve, I mean. But that's it. And when I woke up Saturday, I have a thing about pork. I said, I don't want to eat pork because I believe that pork would make me sick with my arthritis. But I have pain in here since yesterday, and it was gone after work because I took some 3 Aleve, and then this morning I could barely walk with this one here, and it's tight in here.
Is your neck pain gone?
It came back. How to sleep good, how to lay down good. I know it's not as I like before. I can feel a little bit pain, but I can turn it around though. It's not like what I used to. I feel it popping.
Your finger's okay?
Yes, doc. I just have to push it more and more, but it's way better after you give these shots.
Okay, so you don't think you have anything wrong with the neck?
Yeah, my neck, I think I still have a little bit of problem with it.
Where is it?
It's probably somewhere here, doc.
It's a little bit lower than before, right?
Yeah.
It should be a little bit lower.
Oh yeah, it's not like before. Before it was awful.
Yeah. So this will be 5'6" probably. Let me see. So you have a curvature here. It goes like this.
Which is not normal.
No, we have to straighten it out. And we will. So here's where we were before, and this is the next one down, 5'6". And which side of the chin up? You don't go up. How about here? You don't go that way either. That's the concave side, see? So where's the body? Not here. It has to be here.
Yeah.
Right here.
It's right there.
This one?
Yes, doc.
This one.
Mm-hmm.
C5'6". Yeah, that's it. After we open all those on the left, you're going to be straight. Then it turns the way it's supposed to.
Oh, so my neck is crooked then.
Crooked to the left. We got that from your x-ray.
I trust you, doc. Because you give me relief on my first day. I know it's something. And I didn't have headache anymore, which is a good thing.
Yeah.
You just see me before. They called me, even in the house, they told me that I'm like a robot because I would turn around. I have to.
Well, wait till this shot. You're going to really do good with that. All right. As far as your knee goes, that's your knee, right? You're talking about?
It was like, actually,
Which one?
everything here, but you told me that we're going to have to take care of my knee or something. This one, doc, right here.
Oh, that one. Oh.
Yeah. This is worse today.
Well, this is normal. It's a normal knee.
What's wrong with it? It kept hurting me. It's tight.
It's a normal knee. I don't know. Well, how come it's so tight? Do you have any scissors with you?
It's like, no, I mean, right here, the skin, I feel like, that's why I keep coming, my way here, it's like, oh my God.
Well, I don't find anything. Where is it hurt?
It's, this one here, right here, this side.
So on that side. You
Yeah,
said-
and then,
told me
no,
about
this
that
one
side.
here too, doc, right here. It's not in the joints, though. Somewhere, I don't know, it's kind of like here, I feel.
That's what I'm trying to tell you. I can't feel anything. It's a normal knee. Does your back hurt?
Not that I
You
know.
don't have any problem. How did this just show up?
Oh, this one, it's on and off,
Oh.
yeah. It's like, especially with the weather, it's bad.
Let's see. Relax here. There's your cause right there. This one too. You have
Yeah,
both
both of them.
knees.
I'm like a, how old is my pain doc? They always tell me that I'm just 36, 35, but I feel like I'm 70 years old, but some 70 years old can run faster than me.
Okay, the treatment for this, you have, these are knees, they're normal, normal knees. It's a hip,
Yeah, you told me last time.
it's 2 shots. Oh, we had it done already. I did it again.
Yeah, you didn't give me shots
No.
last time. Yeah, but you told me that it was gonna be my hip.
We don't want to overload your insurance.
Oh, that's true.
You know, they'll kick it right out, these people here. We don't know about them, we haven't billed them yet.
Oh,
Your neck, because that's the main thing, and then I'll give you an exercise for this. Next time you come back, we'll do these.
okay.
But I gotta get that curvature out of there. Okay?
All right, Doc.
That's a plan, I think. Okay, lay on your either side, but we're gonna do 2.
I am gonna have a broken neck.
All right, flip over.
Mercy. I know it makes me feel better.
Get more movement. Might take a few minutes. But
I just want to ask because it doesn't I just changed job. Actually, I just got promoted, and they asked for a drug test, and this doesn't, the shots that I had, right, doesn't tell us.
it's not an enhancing performance, you know, that.
Yeah, because I just got it
It go-
today.
It goes outside of your body in 8.5, 9 hours.
Oh, okay. No, I just got it this morning, so. But I didn't take, like, I was hurting yesterday. When I knew that I had to do a blood work, it's actually a urine test. It's like, oh my God. I'm not gonna take any medications because I don't know if it will,
Well, regular medications you should be able to take. I mean, you know, anything that would be prescribed.
yeah. And what I had is.
You gotta stay away from heroin and things
Oh,
like
God.
that.
I didn't even know how does it look like.
I don't either. So how's your neck? I mean, you have more movement?
Yes. Is that cortisone that what he gave me?
No. It is a steroid, but it's not cortisone. If, I'm gonna give you a printout.
Okay, please. I've been telling my,
Yeah, we're correcting all of them.
yeah, I felt difference, yeah.
You feel like you can move your neck. How's
Oh,
your shoulder
yes.
feel with it?
Yeah, yeah, there's,
That was to help your shoulder too, right?
oh, yes. Yeah.
So you're getting help from the shoulder. So it's next time you come back, you'll do your hips.
Very nice.
You can't do everything.
Yeah.
We're just looking at
Thank you, Doc. I can move my hands, so it's good.
What?
I can move my hands now.
Oh.
Oh, thank you.
All right.
So, when will you want me? Next month or 2 months somewhere?
Yeah, a couple
It
days
just-
a week.
okay. All right.
Come on
So is it-
Thursday.
Huh?
If you can come on Thursday, come Thursday.
Thursday?
But I can't really follow through as well as I would like.
No, we treated your back on August 8th.
Yeah,
This
same
year.
thing.
Same thing.
Sam Ting, Chinese guy, you know Sam Ting?
The pain does not come back, so it'll be a different place. Where do you think it is?
I'm not 100% sure, but, because it seems like, but it's right about here, I think. What do you think? I know it won't be.
We took care of the lower one. We did, the 4-5 is up there. We didn't do that.
I know I won't be able to sleep tonight.
Isn't that a shame? Bend forward. Yeah, don't touch anything. Don't touch. Faldo.
Hmm?
You buying his shirts, Faldo?
I like them.
Yeah, these are nice.
Isn't it? They have them Steinmark.
Yeah.
I don't know if they have them anymore.
Okay, bend down. Does that hurt now?
No.
Okay, go backwards. Does that hurt now?
Well, it's feels real stiff.
Okay.
And it goes down. The pain, I've had it where when I first came, it went down, the pain went down to my leg. Now it's not in my leg, but my legs get real stiff from
Does it
it.
go down the side,
Not this time, it's like down, right here, I just felt that.
down the back?
It stopped here, but my legs, like the muscles, it like get pulled, maybe from, you know.
Yeah, I just know where. This side or this side?
This side, right over here.
Over here or here?
Yeah.
Over here?
Here.
In the back?
Yeah. Actually, my left side's not that great either. My right side, I mean. But it's the left side, which is,
Okay, looks like it's, see, we did only the joint last time. August 8th, and I don't know why, because you only had it for 3 days, that's all.
probably. But this I haven't had, just had since, when I say I played golf Saturday. I think since probably maybe Thursday of last week or so.
Well, I think the injury you had was more, we just took it, I thought it was just a joint, but it evidently it's not. All right, shall we go take a look at it? Ready to be a pin cushion again?
Sure. Okay.
Just wait here?
No, following
Oh,
the,
You are a straight man, Larry.
yeah.
Your back looks normal. Everything's good except this one. Right here. You have a little bit of trouble with that. And I'll show you why.
okay.
Hey, I can't get my tree.
Is that your son, isn't it?
Yeah. He's the only one I would trust. I don't trust anybody.
Do it yourself? Show me where to do it, I'll do it.
I can't get back. my hand won't swivel. All right, here's what happened. I'll try this one. This one. You see you have a space here?
Yeah.
See that? And you don't have it on this side. The bone is stuck on the right. Makes it hurt. So that's what all the shots were. Otherwise, you're looking nice.
What's that black line? Looks like a hook.
It's my marker.
Oh,
That's when I hooked the Z's out of here.
He fishes for it.
It's this.
I feel better already, I really do.
You have more range of motion?
Definitely, definitely.
Can you take that, there's a golf thing on the top of that table right behind you? It's just a handle. Can you try swinging that? Like you would normally right there, like do your stroke? It's a nice stroke.
I used to be a good golfer.
Oh, the wrist right down here. Is that where it's bothering you?
Yep.
Okay. Hey, let's take him back. I gotta take a good look at this. Come on back there. It's right under the fusion. If you can get those screws out, you know, we can take care of this and you never have a problem again.
Brady's here. Freddie's here, dropping off the.
Benj. You recognize that from the system, right? Benj. Right, what do you think? Is your pain leaving? Not even gone that fast. 11-12. It's T11-12. Look at that fusion they put in.
That was a bar going across it too. I've never seen one like that.
There's a bar up and down and one across. They don't want that thing to move.
I'm gonna let him sit there and we go get Joyce in the other room. Let him calm down and go get Joyce in the other room.
Yeah, but she doesn't have much wrong. Hey, how's it feel, Joe? Don't get up. Turn over.
Oh, he just missed.
Have a seat. Is it on? Yeah, that's pretty good.
Better? Much better.
All right, here's where it was. Right between these two bones, that's the marker, under the screws. Now, if you can get those out,
All the metal or just the screw?
all the metal, and so you get the motion back. See, when you try to move, you're right in the way of all the motion you get. You put a shirt on, you got motion right there. You swing the glove, you got a motion right there. You lift it up, you got a motion right there. Right here. Anyway, think. Nicholas.
Yes, sir.
And where do you live?
Okeechobee.
Zip
34974.
3.
4974.
This has to be read 2,000 miles away from here.
Oh, doesn't it?
Yeah.
Gotcha.
You know. Now, in insurance you have, they may not pay for the things we have to do.
Okay.
They want prior approval.
Okay.
It's really stupid. Who are these people? They don't even look at it. It's dumb. And it goes off to the side here.
Yeah, it goes off to the side of my right leg.
Left.
It's just going across the middle of my back. It doesn't really go down my left leg. It's down my right leg.
Oh, right. Yeah. How long has this been?
I've been dealing with back issues for a long time. This specific issue, probably since June.
How'd you get it?
My back, it would, with what they say is it would go out. It would kind of slip out for whatever. It doesn't make sense to me, but
No, it's a sprain. It's a leg.
so what would happen? And that would happen, and then it would, of course, take a few days, and it would, rest up, and that's been going on for years. But
Years.
yeah, this specific instance has happened to where it's similar. The sprainer, it went out, and then figured it would just get better, so I went to the gym to do just a real light workout. Just did some arm workouts, and I couldn't finish it because there was like a stabbing pain in the side of my leg. So at that point, I was like, well, this is something a little different. So that's been since about June. So I haven't really been doing
Just
much
wake you up at
anything.
night?
Yes.
You had any treatments for this?
Went to the chiropractor. They thought it was just needed a readjustment, but so they tried that and said, that's not the issue. So I know that's not the issue. But other than that, no. I mean, I've had an MRI, I've had X-rays, but other than that, no.
Okay. What kind of work do you do?
I work at Aaron's, sales and lease. It's
Furniture?
mhm.
You lift it?
Yeah, if I have to. I mean, I'm the manager, so sometimes you got to do everything. So
Yeah, you get everybody else to do
yeah, right.
it. That's why you're the manager.
That's it.
Haven't seen you anywhere.
All right.
Yeah, I was seeing where you were working out. You do have a little muscle there.
Yeah, it's been a while.
Now, you're doing it right. You're
What's that?
getting a little muscle, but you don't get the bulk that you know.
Well, I mean, I've lost some weight.
You don't want bulk. Okay, I'm going to rotate this hip here.
Okay.
Okay, very good. Stand down. Face that wall. Yeah, come back this way. Hold this up. All right, just bend forward now. We're looking for the pain. Keep your legs straight. Just bend down. You have a pain? Put your finger on it.
It's like right in here.
I think it's right here.
Yes, sir.
It's rotated. The bone's rotated. Come back up.
Can I get over there and get a picture?
Hmm?
Can I have
You
turn?
don't see it.
Oh.
Bend back towards me.
Oh,
Bend back,
Oh.
over my hand.
Okay, right
Does that bother you now?
A little bit,
A
yes,
little bit right there?
Mm-hmm.
Okay. Then left. And right.
Feel like pinching, kind of.
You can unbend.
Oh, that'd be great. Thanks.
You just did it.
I might have got stuck.
Someone called up and they said we're out of network in their insurance, which is UMR. Now, we do treatments for UMR people all the time. But in this particular plan, somebody took us off of the list of doctors. And this lady, you have to look at it from a different point of view. She got cheated because she can't go to the best there is. So where does she have to go? She's got to go to some chiropractor or surgery. Is that fair to this woman? Absolutely not. She's losing, and it's a firefighters from Palm Beach County, and her husband is in that group. But they should take out the guy who made that decision, and they should fire him because he is doing the people in that insurance wrong. They have to be able to go wherever they need to go, and they should pay for it. So this in-network, out-of-network, it's just both. That makes no difference, makes no meaning at all. Why? What's in-network, what's out-of-network? I don't know.
It should be what works and what doesn't work, right? You
Should be
work,
what works and what doesn't work.
you get
right?
results.
All right, so here we are. You have a little bit of, you have two problems here, which is giving you the pain. One is your leg is a little bit short on the left, which means that your back is over to the left. Plus, it's sublux right here, which means it's slid in. These are joints. So just right there. It slides in and gets stuck there. So the pain that you have is on the right side, right here.
Okay.
That's the reason.
Okay.
So we have to mobilize the left side, and that pain will come out. It's 2 shots if you want them.
Okay.
You ready?
I'm ready.
All right.
Gotta do.
There's too many people in positions of power who have no reason to have power. And this guy, whoever made that decision, what? I mean, how many people suffer because of that guy?
Yeah.
And the thing is all the other people that she be sent to, they're in the thousands and thousands of dollars for whatever they do.
Yeah, and it's not gonna be good like this.
He's in the hundreds.
See how fast we got to the source,
Jeez.
why,
Right.
and we're gonna take that pain out right now. One day. But I can't do it because your insurance will not approve it. Cigna. And yeah, the 5-1 is rotating.
So what's in the shot that's gonna take it all out, like for the pain and everything?
Takes information out of the label. These are all ligaments,
Okay.
injuries. It's not complicated like I try to tell you. Generation, it doesn't think. It's more a repair process. I'm going to do another small one on the right.
Okay.
That's cause of the problem, but it's a secondary cause. But if you're here, you might as well get the other.
So why is it like on an MRI they tell you like it's a degenerative disc or herniated disc and all that?
Those are reading for a surgeon. So if you buy into that, you're buying into the surgeon. And I'm saying don't do it. There is no degeneration. What you have is repair.
Do they tell you like it's dried out, like?
They're imagining this stuff. They have no way to know that. They don't deal with this like I do every day.
Right.
And I hear this stuff that they say, I say, what the hell's the matter with this? They're making it up. That's not true. Can't be true. All right, turn over. This is where the 2 shots went. And then I put one in.
Okay.
This is where it's at.
Gotcha.
But it looks pretty good.
Okay.
So you should have total relief before you get out here.
All right.
You can take a picture of that if you
You
want.
see that?
Take a picture with your cell phone if you want.
Okay. I will. I'm gonna put my pants back on first.
See it with the bulging disc in there.
Okay. Well, we'll start.
So when you lean backwards and
So when I lean forward, like I still feel a little bit of tightness.
yeah,
Like when I'm bending down, like I still feel it actually coming across my back.
yeah.
Ow, it actually still kind of hurts.
Now bend. See if you can bend backwards. I mean, you may have to wait like a couple more minutes.
I mean, I don't feel as much pressure going backwards. It's mainly with just,
So
when I
backwards
go-
is improved and the forward is about the same. Or
Right, forward would be, I would say it's the same.
Give it a few more minutes. Just sit down and whatever.
Yeah, I still kind of feel it.
Don't way down. Where do you feel it?
It's starting to kick in now. Now I just can feel my muscles just stretching.
All right, you're done. Now look, when your insurance company, if they give me a hard time, I want you to call them
Okay.
and you tell them that you had so much pain that you wanted that done today, that day. And we could play that game, but we don't even know who to ask, because they have to want prior approval on the
Right.
policy. And who are these people? They're just like that guy who took us out of the network. I
Right.
mean, they don't know anything.
Yeah.
They're not here with you.
Right.
I'm here with you.
Good deal.
I wrote a letter to Medicare about you. They paid your bill.
They pay. And I send paper also for you to my attorney. It's not finished yet, my car accident.
Oh, really?
Yes. I have to continue everything to fix.
But you are fixed.
We fix.
Medicare wants all that money back.
Medicare takes my money back when?
Medicare, yeah. Everything they paid, they want it back.
Yeah.
Because it's an auto accident. What was that?
No, it was 2 years ago, not new accident.
Oh, it had nothing to do with this?
No, it's not new accident. It's last.
There was
It
something
was
flying.
2014.
Did you bring that in? I think they're
2014.
chasing you. Hey, what do we do for you today?
But I have pain in my hand. I can't
Hands?
sleep. Yeah, hand.
Yeah.
It's become numb at night. And I can't sleep on the right side. I can't sleep because it's pain. But if I lay
Does the
down,
shoulder
look
hurt you
that-
too?
But yeah, if I lay down, what look like? I can sleep, but on my shoulder, no. It's pain going here, look like under my shoulder, what under my scapula. Something what here, under, around. And if I lay down also to left side, my hand also numb.
How old is this? This is new.
It's, no, we did before, I had also first time when I came, you put for me shots, it was okay for a while, and now it become once again.
We didn't treat you then.
I had one shot in my neck, maybe it was not enough.
We never got it.
No, maybe not.
That was just your back.
No, but I had lots of pain in my right leg. It's disappeared. Now it's every good, everything okay. And before I had also a headache all the time.
Yes, you did. You had 2 shots in your neck,
Yeah,
April 16.
what? And I had a headache all the time. Before I can sleep, I have a headache, big headache, several days.
April 6th.
Yeah, after treatment, it's everything disappeared. My eye now is better. I
She can see better,
read.
she said.
I can read some. Yeah, I didn't read before without glasses at all. Now I can read a little bit, but it's different. And now I feel my body. Before I didn't feel my body. I didn't feel where is pain in my hand, in my leg. I didn't feel just pain and pain, something. And now it's different.
You come to the right place.
Yeah. But I have to finish.
Yep.
Finish. I have to go to skiing to Michigan for 3 months, and after that I'm going to Master World Cup. I must to be prepared to Switzerland
You're gonna ski?
for skiing.
You're skiing in
Cross
Switzerland?
country ski.
You're gonna ski for your country?
Cross country.
Cross country, yeah.
Cross country ski.
That's
Yeah.
hard.
There's a lot of snow over there. You sure you want to go?
Yeah. Mm. But I can lose my hand.
Which fingers go numb? These 2 or these 3?
It's numb, everything numb, yeah.
How about up here?
Numb here. This is okay, but something here. And what you see, I'll have you when you want something here. Now this is I don't have. Something with my hand.
Yeah, let's see. Your hand's good. Let's see your shoulder. Hold it up here. Hold it. Hold it up. Okay. All right, that doesn't do it. This was injected already, C5-6. This was not, 6-7. How about that?
Yeah.
That hurt you right there,
Mhm.
6-7.
Sometimes no pain, most of the time I have. I'm working also all the time.
Well, these are very subtle. I mean, that you could have not much to show. You could have symptoms without showing that much. You have to know how to find it. All right, it's 2 shots if you want them.
Okay,
Okay, lay down. On your side.
on my side.
He's gonna do both sides, so we'll do that side
Okay.
first.
Yeah, it's much better. I have to finish my jobs. My treatment I have to finish.
Yeah, you have to be proactive.
Mm-hmm. It's miracle. I went I was visiting lots of doctors.
How many different doctors you go?
Oh, many.
Like
Only
chiropractor,
a chiropractor, a massage therapist,
massage therapy,
and orthopedic doctors, 3 of them.
surgeons?
Surgeons, and they put from pain also across the street women over there.
Across the street from here?
Yeah, And everyone put for me shot, cortisone everywhere.
Everybody put cortisone,
Yeah,
and it didn't work.
nothing helps.
Well, that's all good information.
What?
She went to all these different doctors, like,
Oh,
right
lots of
across the street, had cortisone by all of
Across the
them,
street?
and none of it
Across the
worked.
street,
None of
paying
it.
doctor over there. It was many years ago.
Came here and got results. You should change your name to Dr. Anthony Results.
Oh,
Anthony
oh,
Results, Pannozzo.
oh, it's in my hand. Oh. I feel
They used
in
to
my
call me
hand.
Dr. Feelgood. That's when Elvis Presley and those guys were getting prescriptions
Oh.
to make them feel good. You know. So they used to call me Dr. Feelgood.
One doctor told me I need surgery in my neck and my lower back. 2 surgeries one day.
Okay, turn over. Let's do the other side. You getting relief already?
What?
Is that arm feeling better already?
Yeah, I feel in my. But it's not. I feel in my hand, yeah. I'm ready.
You can get up, just get up slow.
Yeah?
Yeah.
Oh,
Just make sure you're not dizzy. So you can even test your arm out, see if you can. No, that's what he wants. He's gonna want you to do that.
yeah, I'm afraid. Yeah, I feel only shut here and I feel.
So you feel better.
I feel.
Can you move up
Oh
and
yeah. I move.
do your little victory dance? Okay.
Yeah, I hope it will be much better. Something will happen. Never know from what.
Life.
Why? Already I feel something going in my hand. It's nobody was find out because I went to the doctor across the street. She put for me shot here, shot here. I told her I have a headache all of time. She was treat me, something, exercise, nothing helped.
She put. You said everybody put cortisone in you.
Yeah. After that I went to another place, a doctor. What do you have? I don't know, but I have pain. Put cortisone. Oh, we put for you. But another doctor in Ironwood, Michigan, same thing. He put for me, not here, like over there, cortisone.
Cortisone again.
Yeah, and after that I have pain in my leg.
And you've been doing cross-country skiing for
Yeah.
40 years.
Yeah, and I
In
feel
Russia,
pain
yeah.
also. I didn't know what's happened with my leg. And I went to the doctor, and one doctor told you need surgery in your back. Another put for me shot, also shot.
Cortisone again?
Cortisone once again. And everyone put cortisone, and it's nothing help. They told me maybe we put for you here also cortisone. I don't.
So
That's enough.
when you went to the surgeon that said you needed surgery, because you've come here in April, this April of this
Yeah.
year, and Dr. Pannozzo treated your back with injections, and the result was
Yeah.
success, right?
Doctor.
Without
for-
surgery.
First time I went to the doctor, it was in October 2015. He told me you need surgery in your neck, with cotton and change something. I was thinking maybe not. And when I come back, they put for me 2 shots.
Cortisone,
Yeah,
and it didn't
for a
happen.
while, and told me you come back in March. I will back, and they told me you need surgery. It's nothing help you.
And then you came here.
Yeah, and I was listening to the radio. I'm very, very successful. That
Yeah.
I will listen. Oh, that I can
On the
go.
Love Doctors or 94.3 you listened to, right?
Yeah,
Yeah.
and I was so glad about that. And I came now I'm become healthy.
That's great.
It's unbelievable. Great.
You have a new life. I hope you have a great time doing the cross country.
Okay, bye.
Bye.